I'm Nigel Westwood. I'm a retired now naval officer who was struck down, as it were, by inflammatory bowel disease, as we subsequently discovered a number of years ago now. 1999 I was finally dealt with in that sense. And my diabetes was diagnosed subsequent to the inflammatory bowel disease, and in my mind to some extent almost because of my inflammatory bowel disease, in that I was laid up for months on end, and so on and so forth. I think that the drugs have been important to me because they've brought me under control. They have improved my life, given that my condition had, prior to that, effectively destroyed my life, if you understand me. I lost my career, and so on and so forth. When it was finally diagnosed as ulcerative colitis, it became a bit of a shock to me at that point, because in the past I had always associated the concept of there's something wrong with you, you see a doctor, you take some medicine, you're cured, and you move on. And it was soon made clear to me that that was wrong, and that this was a lifelong condition, and that I would be potentially on drugs for the rest of my life. It was an interesting thing because, outside, being a patient in that sense, before you become a patient, you kind of assume that everything's smooth and there's no wrinkles and, it just works. And then suddenly you find that that's not quite the case, in that I was given these drugs and I was told that these may help, they might not help. And I was quite surprised on some occasions to be given drugs to help with my colitis that in the patient information leaflet said may cause colitis. And you think this doesn't make any sense, and all that sort of business. And I was very fortunate. I had an excellent relationship with my consultant and with my GP, and indeed with my pharmacist. And that helped me to understand what was going on and how these drugs were impacting. I'm very aware today that there are patients with the same condition out there, and because it's a remitting condition, when they're in remission, a lot of them don't take their drugs for a number of reasons. I'm not in flare-up, so why take it? Or they don't want reminding that they have a condition by having to take that drug, every morning or every evening, or both. I was being treated for ulcerative colitis, and my condition was not coming totally under control, and I developed this extraintestinal manifestation called pyoderma gangrenosum, and I was developing significant sores, anything up to sort of 2.5 inches across and maybe half an inch deep on various parts of my body. And I was referred to a consultant dermatologist to deal with that. And he just is the wrong phrase, of course, because he didn't bring it under control, if you see what I mean. But they put me on drugs, which my consultant gastroenterologist then said, these drugs will make your ulcerative colitis worse. And it just seemed to me at the time that it would have been far better if there was some kind of communication between the two, some kind of joined up treatment where we could treat both conditions without initially making one of them worse. But it became something of a surprise to me that the consultant dermatologist really had no knowledge of any other condition that I may have. And I think that there must be thousands of people out there, such as myself, with more than one condition. And I think treating one in isolation is not a good thing. But in terms of my medicines specifically, I'm quite passionate about understanding what I'm taking and why I'm taking it. And I think that patient understanding, informed decision, is an important aspect. And I'm not sure that always happens. I think I'm a fairly forthright and I was going to say demanding, but that doesn't sound quite right, person. And I will engage with the doctors and say, look, what's this about? Why are you wanting me to take this? But I think there are other people out there who just do what they're told. And I'm not necessarily convinced that that's a good thing for progress in general.